Hello everyone, I am Akanksha Jain from IGCP Group and MedTalks Healthcare. Today we are here to discuss the most searched questions on Google about blood donation and its after process, blood transfusion. Today, to answer these questions in the most authentic way, we have invited the best hematologist, Dr. Vikas Goyal from Sanjeevni Cancer Hospital, Raipur. Welcome to the show, sir, and thank you so much for joining us in this live to answer the most searched questions about blood donation and blood transfusion process.
Thank you for inviting me for this very good talk on blood donation because there are many myths and we have to bust those myths. So I am Dr. Vikas Goel. I am a hematologist working in a Sanjeevni CBCC Cancer Hospital, Raipur. And today I will be answering all the most common asked questions related to blood donation. So let's have the questions, please. Okay, it's a very good question. What happens to the blood we donate? So after donation of the blood people will check the blood or its sufficient quantity is there or not. And if the donor has donated whole blood, this whole blood can be transfused as such to the patient, or this whole blood can undergo separation technique. So blood can be separated into either red blood cells or plasma or platelets. So depending on the requirement of the patient, if the patient is having anemia, low hemoglobin, red blood cells has to be transfused to those patients. If the patient requires platelet, then the platelet which are separated, we have to give platelet to those patients. So it depends what is the requirement of the patient. If the patient requires whole blood, the all the donated blood without separation, we give blood to the patient. And if the patient requires any specific component from the blood, then we separate the blood into those components and then we transfuse the blood. Next question, please. The answer is yes. Whenever you donate the blood, it is used fully. So, by giving 1 unit of blood, a donor can benefit three patients. If the patient is having anemia, red blood cells can be given to the patient. Whole blood is separated into plasma. Plasma is required in some of the specific diseases in which plasma is transfused. And platelets. When the patient's platelet counts are low, patient is at the risk of bleeding, and in those cases, platelet we have to transfuse. So the all the donated blood it is used, it is not discarded. Every component of the blood is used so that maximum number of patients get benefited. Let's have the next question, please. So usually when you donate the blood bank people will give you either some liquid. It can be in the form of juice or milk or water, and along with they also give you some snacks like cookies, biscuits, etc. The reason behind this is that some of the people, otherwise blood donation is a very safe procedure without having any side effect. But some of the patient we have seen that they complain of nausea or lightheadedness or dizziness. So to prevent these of the symptoms, which occurs in very less number of blood donor, we give them cookies. So if the after donation of the blood, if the donor has taken adequate liquid and cookies, so this will prevent some of the side effects I told, like lightheadedness, nausea, dizziness. So this is the reason donor has to take cookies after donation of the blood to prevent some of the side effects which may happen to some of the donor. Let's have the next question, please. So the question is, what are the benefits of donating blood? So there are many benefits. First of all, we are saving the life of the patient by donating blood. So this will save the patient's life. But by donation of the blood, the person who has donated the blood, that person also gets benefited, because research has shown that those persons who regularly donate blood, they have less chances of developing heart related complications like heart failure or angina or other heart elements. Also, it has been seen that the liver becomes healthy, because by donating blood, the excess iron whatever deposited in the body, it gets eliminated, so body doesn't get affected by excess iron. Psychological benefit, research has shown to decrease the stress level in the person who regularly donate blood. And also feeling of well-being. Some of the donor has says that they are feeling good after donating the blood. So these are the various benefits of the blood donation. Also, whenever a person goes to donate blood, he goes various type of investigation, his bp being checked, bp, pulse, temperature. Donor also undergoes some of the blood investigation, so HIV, hepatitis, malaria. So these are the tests being done on the donor. So the donor himself gets mini health checkup. So in this way, patient will be beneficial. Donor will be beneficial by knowing all this. So he can some of the disease may be diagnosed during the blood donation. So these are the various benefits of donating blood. So I would encourage all the person who are fit and fine, who are in the age category of donating blood, should donate blood. So let's have another question, please. So this is a very good question. How much blood a donor can donate? So it depends on the uh, what component he is donating. If a donor is donating whole blood, then he can donate blood every 56 days. And if the donor is donating platelet, he can donate platelet every 7 days. And if the donor is donating plasma, then he can donate plasma every 28 days. So this depends on what component patient is donating. So these are various guidelines we follow whenever we take the person for donation. And also there are certain factors which we have to take into the account, like person's age should be more than 18 years, patient's weight should be more than 50 years, he should not be taking blood medicines like blood thinners, other antibiotics, thyroid medication. His sugar should be well controlled if the patient is diabetic and is on diet. So these are the various indicator which we follow whenever a person comes for donation of the blood. At one time, if the person is donating whole blood, then we take out about 350 ml to 450 ml of whole blood. And if the patient is donating plasma, the quantity of plasma is around 200 to 300 ml. And if the donor is donating platelet, at one time he can donate around 200 ml of platelet. So depending on the indication of what the patient needs and what the component we are taking from the donor, so this will decide how much blood a donor can donate. Let's have the next question, please. So I think this question has already been answered. What happens when we donate blood? So when we donate the blood, you go to the blood bank. They will do minimal checkup. Your BP and pulse will be taken. Some blood investigation you have to go through, and if all comes normal, you have to be seated in the reclining sofa, and they will clean the area from where blood has to be removed. they will clean the area, and they will prick the needle into your vein, and they will secure the area with cello tape or any other paper tape. And it usually takes about 10 minutes when you donate blood. The actual procedure takes about 10 minutes, and when the adequate quantity of blood is being removed from the body, the needle will be removed, and one bandage has to be put on that area. So this is the procedure we follow whenever a donor comes to the blood bank for the donation. And after the donation, we give the donor some liquid and some cookies so that he doesn't develop any of the side effect of donating blood. Let's have the next question, please. So there are four types of blood donation. The one type is whole blood. This is the most common type of blood donation. Patient goes to the blood bank and they remove whole blood, like they will remove their RBC, platelet, plasma, whole blood. So about 350 to 450 ml of whole blood will be removed. This is called whole blood donation. Another one is platelet donation. In platelet donation, uh, we take out the platelet only, and the one donor can donate platelet every 7 days, and we take out the only platelet from the body of the donor. In this method, we don't take plasma or red blood cells from the donor. So this is the second type of donation, platelet donation. The third type of donation is plasma donation, and in plasma donation, the procedure is same, but in this process we take out only plasma from the body, and the rest of the blood gets automatically again in the donor's blood. And one person can donate plasma every 28 days. During COVID times, we have seen that many voluntary donors have donated plasma who has been recovered from the COVID infection. So this is the third type of donation, plasma donation. Fourth type of donation is red blood cell donation, and in which the when we take out only red blood cells from the body of the donor, and one person can donate red blood cells every 112 days. So this is the fourth type of blood donation. We call it red blood cell donation. So these are the four types of donation, in which whole blood donation is the most common type. Let's have the next question, please.
Sorry. We have comments coming up in. So the first comment that I can see is people having HB like 17.7 can donate blood.
So we have to investigate those patients, because this is more than what is the normal value of HB. If in a male patient the HB is more than 16.5, then we have to investigate why the person is having more hemoglobin, because some of the patient may have polycythemia disease. It is a disease, and if the patient is having polycythemia and the person's HB is more than 16.5, so those patients should not donate blood. uh, those patients should undergo phlebotomy, and we have to remove the blood from the body and we have to discard it. We should not donate this blood to the patient. So any person having HB more than 16.5, he should undergo some investigation to find the cause, and donated blood should not be taken in those type of donors.
Okay. So the next question that we have is which patients cannot donate blood?
So there are some criteria. The person should be fit to donate blood. I said age criteria. Patients person age should be more than 18 years, between 18 to 60 years. The duration between two donation, like for plasma donation, 28 days gap is there. So if the person has already donated plasma in last 28 days, he should not donate plasma. And there are various diseases, like if the patient is having malaria infection, syphilis infection, HIV infection, or if the patient is taking some of the medications like blood thinners, thyroid medication, antibiotics. So those persons are excluded from the blood donation. And also, if we have tested the patient person, and if his BP is high or any rhythm irregularity, if the person is pregnant, breastfeeding, or the person is having some congenital disorder like sickle cell disease or thalassemia, so these persons are excluded from the donation, because the donated blood may harm the patient. And also donating blood may cause heart disturbance in a donor. If the patient is already having heart patient, so removing blood can harm the patient. So various disease, some medication, age factor, these factors we have to take into account. And if all the indications are met and person is fit, then we ask the person to donate the blood.
So the next question is asked by Krishna Kumar. Side effect of blood donation.
So otherwise, blood donation is extremely safe procedure. We should not afraid of any side effect. Only rarely some of the donor complain of nausea, like vomiting sensation, lightheadedness, dizziness, giddiness. But all these symptoms, they disappear within minutes or hours. So I will say that the blood donation is pretty safe, and one should not afraid of any side effect. And we can prevent the side effect by taking adequate liquid before donating the blood. And also after donation of the blood, one should take liquid, maintain hydration, and take some cookies or biscuits, so that these side effects can be prevented.
So the next question is, what are the do's and don'ts before donating the blood?
Okay. So one should know his physical fitness before donating blood, and the person should undergo all the criteria, whether he is meeting or not those criteria. Just I said, age criteria. If the patient is having fever, then he should not donate blood. Patient should take adequate diet and liquid before coming to donating the blood. After donation of the blood, he should take plenty of water and get some cookies or biscuits or light breakfast the person can take. And the person should not hide any medical information to the blood bank people. If if the person is diabetic or hypertensive, or whether he is taking any medication or not, he or she should not hide any medical information, which will help whether the blood donation is safe or not. Otherwise, it is a very routine procedure. Anyone can go walk in to the blood bank, and all the reports are normal. Then the person can donate the blood.
So the next question is from Pooja. Does giving blood make you feel tired?
So most of the patient doesn't complain of any weakness or dizziness or feeling tired, but some of the patient may complain of this symptom, because in our body have about 5 liters of blood, and when we are donating blood, we are hardly giving 10% of the blood to the blood bank. So body compensates by itself, and most of the patient doesn't feel tiredness or weakness. Or if the patient is feeling tired or weakness, then they can take some breakfast or some snacks, so that he will not develop any symptoms.
So our next question is asked by Sanjay Kala. Sir, one question. Does person lose antibodies made after being get recovered with COVID?
Yes. So after getting infected with COVID, two types of antibodies are made in the body. One is IgM and one is IgG. IgM antibody disappear very fast from the body, while IgG antibody persist in the body for a long time. So suppose one person has infected COVID and we are doing a test for antibody after 2 months. So in those patients, the IgM antibody may not be visible by testing, but patient will be having IgG antibodies, and within course of time, antibodies have life. So as soon as time passes, the gradually the antibody level decreases in the body, and most of the cases after 6 to 12 months, the body have very less amount of IgG antibodies. So the answer is yes. The antibody quantity of the in the body declines after getting infected with COVID.
Okay. So the next question that we have is, what is the exact reason for keeping minimum age of donation 18?
So this government has formulated some of the guidelines. In India, the legal age for donation is blood donation is 18. Some of the countries it is 16, and some of the countries it is 17. So the full body development takes place till the age of 18 years. If we are removing blood from the person's body before the age of 18 years, so this may hamper the physical growth of the person. So that's the reason there are guidelines that age cutoff should be 16 years, 17 years, or 18 years. Because before that age, person himself requires blood in the body. So if you take out the blood, the person may not get benefited. So that's the reason.
So the next question is again from Krishna Kumar. After COVID, can I donate blood?
Yes, it's a very good question because we have recently seen 2 3 waves of COVID, and as we if you follow the guidelines, at least 3 months after 3 months of recovering COVID infection, one person can safely donate blood. So if, but at that time patients should not be having any symptoms of COVID. So that is the one criteria one has to follow. And if the 90 days have passed from the recovery of the COVID infection, a person can safely donate blood.
Okay. So our next question is from Dheeraj Kumar. How much weight do you lose after donating blood?
So during one blood donation, the person donates about 350 ml to 450 ml of blood. So that equals about 320 to 420 kilogram, 3.2 to 4.2 kilogram. So on the average, the person loses 3.5 kilogram of body weight after just donating the blood. But this again the body recovers, like body reacts to this blood donation, and within few weeks the patient's weight again becomes normal because blood forms in the bone marrow, and bone marrow gets activated, and the donated blood replenishes in the body once again. So after few weeks, the whatever the person has lost weight, eh, they regain the weight. Yeah.
So our next question is from Shanu Goyal. How many liters of blood do we have in our body?
So an average adult person have about 5 liters of blood in the body, and during donation we take out about 350 to 450 ml of blood.
Okay. So Kamna Rai asks us, how long does it take to recover after donating the blood?
So if you are donating the blood, whole blood, if you are donating the whole blood, it takes about 2 to 3 months to get recovery. And if you are donating platelet, then in about 7 days, the body recovers after donating platelet. And if you are donating plasma, the body takes about 4 weeks to recover. So it depends on which type of blood donation you are giving. Most common blood donation is whole blood donation, so it takes about 2 to 3 months to recover from the blood donation.
Okay. So Pratik Manwani asks, can a person having G6PD donate blood?
So if there are two types of G6PD deficiency. One is heterozygous and one is homozygous. And if he's a milder variant, he is having G6PD deficiency, that patient can donate blood to the other person. But if the patient is having G6PD deficiency and patient is having active hemolysis, then the person himself will be having low hemoglobin. So yes, milder variants of G6PD patient can donate blood, but if they are having severe G6PD deficiency, they should avoid blood donation.
Okay. The next question is from Kudrat Wazir. How many months after can donate a young healthy?
Okay. So a person can again donate after 56 days. If person is donating whole blood, then after 56 days, the person again donate blood. And if the patient donating platelet, because platelet life is only 5 days, and the body recovers very fast for platelet. So if you are donating platelet, then every 7 days one can donate platelets. So it actually depends on the type of blood donation the person is doing. For platelet, it is very minimum every 7 days. But if the person is giving whole blood, then every 56 days the person can donate.
So Deepak Das asks us, can a hypertension person donate blood?
A hypertensive patient can donate blood, but at the time of blood donation, patient should have his blood pressure controlled. The patient is having hypertension, the person must be taking some antihypertensive medication. If his blood pressure is well controlled, then of course the patient can donate blood.
So Shyam Lalwani asks us, what is the solution of thalassemia?
So thalassemia is hereditary red blood cell disorder in which there is a deficient production of red blood cells in the body, which results in the recurrent anemia. Two types of treatment are available. One is curative. The curative treatment is bone marrow transplantation, in which the donor stem cells are taken, and after processing, the patient receive those stem cells. This is we called bone marrow transplantation. So this can be done only if fully matched donor is available or partial matched donor. And another treatment is medical treatment, in which we regularly transfuse patient the blood, and we have to control the iron in the body also, because of many regular blood transfusion, there is iron accumulation in the body. So we give iron chelation to the patient. So to remove the excess iron which is deposited in the body, we can remove it by the various medication. So two types of treatment: bone marrow transplantation and regular blood transfusion. So depending on the patient's condition and availability of donor, one has to choose between the two. Bone marrow transplantation is a curative procedure, while regular blood transfusion is the supportive procedure.
So before we end this slide, sir, would you like to give us a few tips on, words of encouragement to donate blood?
So today is World Blood Donor Day, and I would request all the person who are fit and fine, who can donate blood, they must donate blood. It is a very safe procedure, and by giving blood, you are not only saving the patient's life, but you also getting many health benefits for yourself. So I encourage all of you, go ahead and donate the blood. You can save the life. You can be hero of one of the patient. So my request is to all the person who are watching me here, they should enroll for any blood donation. Regular blood donation campaign has been organized by various organizations, or they can simply go to blood bank also, and this will be very beneficial to the donor as well as the community. So my message is that it is very safe procedure, and one must donate the blood if he is fit for the blood donation.
Thank you so much for this amazing encouragement speech, sir. We we would really like to know more about it some other day. So thank you for joining us in this live and answering the questions that our audience has asked. I hope they all have their answers by now. And